In rapidly and constantly evolving health landscape, urgent action is needed to address the challenges countries are facing, including an increasing number of COVID variants, commodity shortages, limited access to vaccines. Alongside measures taken to meet the needs of communities, support health workers, and distribute COVID-19 vaccines in these circumstances, countries must also diagnose and implement fixes for the broader weaknesses in health systems exposed by the current pandemic. And primary health care, PHC, must be central to these efforts. Well, joining us to talk more about this, Dr. Lalapo Ashinobi is a public health physician. He joins us here in Lagos. Welcome to the program.
Thank you very much, Millicent.
All right.
Good evening, Nigerians.
I'd like to begin. Is there a health for all policy in Nigeria?
Yes, there is a health for all policy. The Constitution says so clearly. That is the responsibility of government to provide for the health of the citizen. Unfortunately, these are part of the responsibility of the government that the citizen cannot take the government to court to enforce. So you just pray on the goodwill and your voting power to see that you put the right people who understand this concept and hope will implement them religiously.
So it's all hopes, and then this is essentially something that exists on paper, but practically?
Okay, so practically, we have to practice what we preach and put our best foot forward. And our best foot is the primary healthcare system. WHO says it, everybody knows it. So why is it called primary? I mean, if you start any journey, educational, you have to start from the primary before you go to the next level, before you go to the next level. You cannot run before you start crawling. So the primary healthcare is the closest health system to the people. And it is what everybody should hook up to understand. So like I said before, though you cannot take government to court, but you can make government responsible. And the only way you can do that is for the people to be involved in their own health system at the community level. So it starts from the home to the community to the smallest political unit in our law, which is the ward. Now, Nigeria runs what they call a ward health system. That means it is organized in every political ward within the 774 local governments. Because politically, every ward has a councillor who is at the legislative home of the local government. So they can advocate, they can even pass law, they can even pass budget to support the primary health care at the local government level. However, because health is on the concurrent list of the Constitution, so as the local government is responsible, the state government is also responsible, and the federal government is also responsible for health. And so everybody must see the primary healthcare system as a baby to ensure that we'll be able to meet it. Look at the COVID, for example. So all these figures that you reel out every day, this number of people are tested, this number of people are vaccinated. However, for every single person who is tested, you have a minimum of 4 to 10 people who they are in contact with. And this contact need to be traced by human beings. Now, who does this tracing? Who is the food soldier? The food soldiers are the primary healthcare system health workers. So they get their phone numbers, they visit them at home, they provide home-based care. Now, the commissioner, one of the people on the last view, was saying that you need to sensitize religious leaders, bring them on board. Please, who will talk to all the different religious leaders in every community? It is the primary healthcare system workers. So they know every church, every school, every mosque, every traditional home. They are known in every community. Now, you must bring those community leaders together to give them a picture of what the health system is and what their role is in it.
So with the current system that we have,
yes,
primary health care,
yeah,
does it help us? Has it helped us in the past in fighting infectious diseases, yes, the pandemic?
In fact, now more than ever before, we need to now focus on that primary healthcare system. It has helped us in the past. It is failing because the governance structure around it is also failing. However, we can strengthen it. It has 4 major areas. I'm glad the Vice President And this country wants to reform the health system. They just set up a health reform committee. But I'm saddened that of all the mandates, there was no specific mandate to look for, babysit, to feed the primary healthcare system so it can fulfill its pace. So that system will cater for 80 to 90% of our health problems, including common endemic and epidemic disease. So if there's something is epidemic, that means it's just coming. So COVID is a new worldwide epidemic, and that's why it's... But now, everybody is getting used to how to manage it. Everybody now knows how to wash their hands, when to keep social, how to get vaccinated. So we are learning, and so we're going to learn to live with it. Now, what are the 4 major areas that I hope and I expect the government to look at for primary care system? One is the governance. Now, the governance we need to have for primary care system is the one we call the do with, not do for, and do by. So that means you do it with the people. So the people understand what their problems are. You just need some people to help them focus on how to come together to provide a solution. So you get into a community where there is diarrhea, right? I'm sure if you tell the people and explain to them the link between poor water and poor sanitation, and teach them how to wash your hand, how to filter your water, when to drink, when not to drink, and how to take someone to the closet, they will know what to do. You're not going to filter their water for them. You're not going to boil it for them. You're not going to tell them where to go to when they're ill. They know what to do if you not give them the information. So they come together, form like a social group, and move as a force. And they know what to do, how to help people. So that governance has to come at the ward level, so the people will take charge of their own health system. The second thing that we need to be looked at is funding. Funding is a very big part of it. Now, if the governance structure is settled, then the people will know how to mobilize resources. Then government will now bring what they need to do to complement local resources and move things forward. However, at the government level, we've turned our funding mechanism on the head. So it's a pyramid that is standing on the head, the sharp base. And you know, if a pyramid is standing like it will tilt. So the part of our health system that will give the greatest funding is the specialist and tertiary care, where less than 5% of the people can go. I don't think everybody who has malaria will go to a teaching hospital, a specialist. They go to primary. So what? The funding is reversed, followed by the secondary, then the primary. So I think we need to tilt it and make the base that has the widest reach get the widest funding. Luckily, federal government has tried. They've put up something in the National Health Act that says 1% of the consolidated revenue fund should go for primary health care. So the states can replicate and the local government. So funding is a very big issue from partners, from private sector. So COVID did something very good. That's the private sector coalition for COVID. However, they focus their energy more on the very big things. So building isolation centers, bringing in medical equipment, very sophisticated. That's the specialist care.
So you think they should look
They should just look at the primary care. Give them power, give them humans, give them ambulances, and all these things will be sorted out. Now, the third thing is we need to look at how do we use the health team and the people to ensure that they look at their own problem. The fourth thing, they have to look at the framework for accountability. So any system you put up that you do not review and is not accountable to those who set it up will now become what we call a lot of policy in the books and will not make results. And I know the people can do it, and Nigeria is made up of very smart people. And if they want to go, they go. And I trust us to do well.
Thank you so much. Dr. Oladapo Ashinyobe is a public health physician talking about the importance of the cornerstone of Nigeria's health policy, primary health care. Thank you so much for coming on the program. Still to come, thousands of nurses in Australia go on strike as COVID cases mount. Join us again.